After many years suffering painful knees, Liz Coveney has a new lease of life. And it's all thanks to a new and quite remarkable surgical procedure. A procedure involving regenerative medicine that until recently was classed as experimental and therefore not widely available to patients or routinely funded.
Nice to see you again, Liz.
A year ago at Spire, Southampton Hospital, Liz's orthopaedic surgeon, Mr. Phil Chapman-Sheath, implanted the first and only European-approved advanced therapy medicinal product into her knee to repair a cartilage lesion. At that time, private insurer authorisation had to be approved on a case-by-case basis.
Hello, Liz. How are you?
But now Liz has had the same groundbreaking operation on her other knee with a much smoother funding process. It follows the decision by two of the largest UK insurers to routinely fund all patients who surgeons deem appropriate for the cell-based therapy characterised chondrocyte implantation. Phil Chapman-Sheath was the first surgeon in the UK to treat private patients with a CCI product after its market authorisation as an advanced therapy medicinal product.
What makes this revolutionary is that regenerative medicine has traditionally been restricted just to research, but now, for patients, they can gain access to an approved product made from their own body, enabling them to heal themselves without the need to be enrolled in a clinical trial. And now that for two of the insurance providers funding is routine, we hope that many more patients can potentially benefit from this new and very exciting procedure.
9 weeks before the first operation, Liz had a cartilage biopsy taken from the non-weight-bearing part of her articular cartilage. This small amount of cartilage was then taken to the Tygenix cell expansion facility in Belgium, where the chondrocytes were extracted and then expanded and cultured to create the only approved cell-based medicinal product.
Unique to this process, Phil Chapman-Sheath and Liz were able to plan their surgery. Prior to the CCI process being available, they were at the mercy of when the cells were ready. This means with the CCI process in place, they can choose surgery between 9 weeks and 3 months, which makes the logistics of planning the second stage of the surgery so much easier.
Liz underwent a general anaesthetic prior to a mini arthrotomy being performed on her knee to facilitate the implantation of the advanced therapy medicinal product. The area of damage on the articular cartilage on the end of her thigh bone was exposed and prepared by creating well-defined sharp edges to the lesion and removing any remaining cartilage from the bony surface. The surgeon used an aluminium foil template to determine the perfect shape to cut a collagen membrane to the size of the defect, prior to taking the product from his nurse assistant and seeding it onto the back of the membrane. It's now ready for implantation. Securing the membrane with the cell beneath is the final piece of the jigsaw. The procedure usually takes less than 1 hour prior to the patient's knee being closed and the start of the semi-personalised physiotherapy and rehabilitation that'll help the implanted characterised chondrocytes to regenerate the cartilage. The procedure on both of Liz's knees has been very successful. She's been able to return to a fully active life with the hope of delaying the onset of osteoarthritis.
It's been absolutely great, ever so easy, 2 new knees, 2 good legs to stand on. Second time around it's been absolutely fabulous. The funding was so much easier and I was a lot more confident that it would be funded.
Routine funding of this therapy is a major benefit to patients who are suitable for the procedure. It's reassuring for both the surgeon and the patient that we can now concentrate on the welfare of the patient rather than the distraction and uncertainty of funding authorisation.
The routine funding of a regenerative medicine product is a huge step towards cell-based therapy becoming the standard of care for appropriately indicated patients. Although, as with any treatment, patients should always check with their insurer that their authorisation is in place. For many years now, regenerative medicine has promised much in research, whilst delivering little in terms of patient-accessible therapy. CCI is helping to show the way for other regenerative medicine therapies and is heralding a future where perhaps we could regrow our failing body parts to live longer and be more active in later life. What was once considered science fiction is now reality, at least for articular cartilage damage in the knee.